Welcome to Nourish MD, Doctor Dietitian Dialogues, where doctors and dietitians empower you about your health and discuss and provide a better path to health and wellness. Proudly presented by Concierge Medical Practice Private Physicians Medical Associates, PPMA, with your hosts, registered dietitians and nutritionist, Papanos and Romana Brennan.
Hello, everyone, and welcome to Nourish MD. Today, we are joined by all three doctors, Dr. Weiss, Dr. 𝗵𝗲, and Dr. Davis. Thank you so much for being here, and we can't wait to have a conversation about PPMA today. All right, well, why don't you just start off, Dr. Weiss and Dr. 𝗵𝗲, by telling us how PPMA came to be. How is the relationship and the vision of PPMA created?
Well, Dr. 𝗵𝗲 was in a practice with some other doctors, and I joined the practice in 1986, and then we worked together in that practice. He had been there for 7 years, but I worked there for an additional 16 years, and Dr. 𝗵𝗲 and I decided that there had to be a better way to provide care for our patients, and that's when we left, and I left and started PPMA in 2003.
Wow, amazing.
Can you tell us what makes PPMA different from a traditional doctor's office, traditional practice?
Well, like Dr. Weiss said, we left in 2003 primarily so we could cut the number of patients that we had overall. And we cut it down to a sizable amount that we could spend time with people. I think the biggest thing was the availability we had for patients and the time we could spend with them initially. As the years went on, we added a lot of ancillary things, including the nutrition. But I think that was the primary reason.
And can you just give us an overview, Dr. Weiss, of some of the services that PPMA provides?
Well, first and foremost, we're physicians and we provide medical care. We are internists, which means we do not see children. We provide primary care for adults. And that's really what our main mission is. In addition to what people think of as traditional medical care, writing prescriptions, sending people for x-rays, we also have, over the years, have developed an extensive focus on what I'll call wellness, which really means how can we make people healthier without writing prescriptions and without sending them to the surgeon to have parts cut out or whatever. So that is what has driven our ancillary services, as Dr. 𝗵𝗲 mentioned before. Nutrition, having dietitians on staff is a hugely important part of what we do. But we've developed services related to that. One of the things, for example, that we call pharmacy with an F rather than a PH, to emphasize how important it is that, as Hippocrates said, let food be your medicine, and that's the emphasis there. What other?
I think, and then we have all the other ancillary things like the advanced care, and we also do all the blood pressure and the home weights, etc. that we do, which I think people have found very helpful, particularly the elderly. And during the COVID episode, that really allowed us to stay in touch with folks. So I think they've found that pretty valuable.
Yeah, so the PPMA at home, like you mentioned, the advanced care planning and the remote patient monitoring, which is the blood pressure and the weight, as you mentioned. And then maybe you can just talk a little bit to the concierge medicine model and how that's a bit different than a traditional doctor's office.
Well, again, the concierge model allows us to cut the number of patients, significantly decrease the number of patients who we each care for, and put numbers on that. It's been studied, and a traditional internist has 2,400 patients. And we limit our practice to 400. which allows us to provide care for our patients that they deserve. And, it gives us time to sit and talk, gives us time to answer calls. Probably the most common complaint I'm getting from patients is other doctors' offices don't return calls. And if they call for an appointment, it's 3 months. Or, if somebody has an urgent medical problem, obviously providing care 3 months from now is completely absurd. And that's not what we do. We have live, our staff get a live person when you call. We can see people same day, next day. We get back to, somebody calls, we get back to them same day, or at least we do our best to do that. Answer emails, texts, etc. So we're available.
Certainly sounds like there's a lot more proactivity and attention that are really key pillars of the practice.
Absolutely. Yeah. Well said.
Yeah. Dr. Weiss, you touched on this a bit, so maybe we can hear from Dr. 𝗵𝗲. Why do you believe that as a physician, nutrition plays such an important role in patient care?
Well, I think since we've been in concierge practice, I think one of the things that the traditional medical model had was you didn't really have the time to talk to people. And I think the 15-minute visit was a lengthy visit in our old days. When we were seeing, like Dr. Weiss was saying, you have 2,400 patients. You're seeing fast and furious. The idea of now that we were able to sit down and talk to people for a lengthy period of time, get to know them, know their disease, it's obvious that the nutritional aspect of it was something we overlooked in those days. It was the supplements, the nutritional aspect of things that we overlooked, I think. And I think over the last few years, as you guys would kind of adhere to, was the fact that gut health and all the issues that we now deal with today has become a much more important part of our practice. So I think that concierge has allowed us to sit there and discuss that in a lot more detail.
Surely. And maybe you could just provide us an example, Dr. Weiss, of when you see a patient in your office and you think that nutrition would be a valuable conversation for them to have. What does that process look like of how you integrate nutrition into their care plan?
So my initial thought is, when is it not? I mean, people eat 2 to 3 times a day every day, right? And they have to make a choice every time they put a fork to their mouth. And, I know later we're going to be talking about cardiovascular disease, which is the #1 killer in this country. And the frustration is that it is completely treatable in general. For the vast majority of people, it's completely treatable without medication. But people need to do it, and people need to want to do it. We can provide the education. Lauren, you're great at doing it, but they have to be receptive and want to do it. And it's my opinion that in the United States, we're not set up for it to be easy. So if somebody really wants to do it, they have to work at it. And, everybody has busy lives and it can be difficult. So the answer to your question is, every single patient encounter is a great opportunity. The real question is, when are the patients receptive? Because if they're not receptive, then I can say anything I want. It doesn't matter.
Sure. Yeah. And I'll just say that on my end of things too, being a dietitian, I've worked with several physicians over the years, and I think you guys do a really excellent job of always incorporating it into the conversation. So I know that even just the labs that you order, checking their omega-3s and their vitamin D, their B12, and looking at some of these nutritional markers, and then, recommending you should be taking this vitamin to replace that, or you need to see nutrition follow up, you need to reduce sugar in your diet, and providing them that next step. I think that a lot of times we hear in conversations that physicians might say, nutrition is so important, food first, but then there's not the actual integration of what that follow-up looks like for the patient. And so I will say that I think you guys do a really great job of integrating it into your conversation.
So what in my mind, what led to PPMA having a dietitian on staff was I would talk to people, and they'd have elevated blood pressure, cholesterol, whatever it was, elevated blood sugar, diabetes. And you always have to write a note. In my note, in the plan, it was diet and exercise. And I would write that and I'd think, what does that mean? And it became important to have it mean something and be able to say, listen, I'm not the best person to talk to about your diet, but, and schedule an appointment with you.
Mm-hmm. Yeah, amazing.
Well, I remember the times when we first started, we actually would sit around and we ask, what do you recommend for anybody to have any nutritional value? We say, 1 a day vitamin. And I think Dr. Weiss and I then decided maybe it's time for us to go to some of these conferences that had some nutritional aspect to it. So initially, when we had plenty of time, we took trips to New York. And I remember going into a place that the first thing for lunch I faced was a tofu hamburger. And that was a kind of an interesting experience.
Not your favorite?
Initially it wasn't, still isn't, but it was, originally wasn't. But it got us onto this pathway that we're talking about, that was a very important aspect. Patients would be asking us information on what is proper diet, because they're seeking information as well. Mm-hmm. And Dr. Weiss and I thought that when we start this program for the last 21 years now almost, we've done this, we've advanced our knowledge as well as really answered the patient's questions.
I think the tofu scrambled eggs were particularly bad. But one of the things that's happened, as you well know, is the choices out there now are much greater and taste better. So people can, with the proper education, have the opportunity to eat a much healthier diet and not suffer with tofu scrambled eggs. And I think it's very important to make one other seemingly unrelated point here, and that is, Dr. 𝗵𝗲 mentioned the importance of the gut, and that is not well recognized, in my opinion, but it's so important. And one of the things I want to thank you for, Lauren, is how much you've recognized it and how well you work with our patients to get their guts healthy, because that makes them healthier people.
Absolutely. All disease begins in the gut, right? Maybe not all, but
it's hard for me to understand how a broken arm begins in the
gut. Discover the wellness you deserve. At Private Physicians Medical Associates, PPMA, you'll receive personalized premium preventive care and one-on-one medical attention with an emphasis on prevention, nutrition, and wellness. Extended office visits, appointment availability, 24/7 physician access, limited patient enrollment, PPO insurance and Medicare accepted. This is concierge medicine. This is medicine the way it should be. Call today for a free consultation at 949-566-8179.
Well, I think you've both done a really great job at describing for the audience just the difference that the PPMA practice, what makes it unique, what makes it different from a traditional practice. So I'd like to get a little bit deeper into each of your backgrounds. And Dr. 𝗵𝗲, if you'd like to start us off, do you want to just tell us a little bit about yourself and a bit about your background?
Yeah, I could probably. I'll start with my undergrad. I went to UC Davis. I was going to be a veterinarian, got admitted to vet school there, but at the same time applied to medical school like guys did in those days. You applied everywhere. And I got accepted to medical school, and I decided to switch tracks. So I came to UCLA in 1969. So that's when I came to Southern California, graduated in 73, was drafted during the Vietnam War, was deferred till I finished my residency. Went in 1976. I went in as a medical doctor at Fort Knox, Kentucky. We teach medicine there for 2 years, and then got out, did a fellowship at UCLA in pulmonary. In 1980, decided I was going to leave the university system and came out in private practice. So I've been in Orange County since 1980. And 1980, joined a group that Dr. Weiss had mentioned, in Huntington Beach, and it was fee for service at that time, a different system. And then Dr. Weiss joined us in 1986. We got up to about 5-man practice at that time, and then in 1999, 2000, we started seeing the system getting overloaded with the whole managed care system, and we were seeing a tremendous number of patients, which was pretty stressful for everybody, patients and doctors. And that's when we both kind of sought out this concept called concierge medicine. Then we became concierge doctors, first ones in Orange County in 2003. And here we are 21 years later.
We are. Mm-hmm. So you obviously have a love for medicine, whether it was animals or humans, right?
Yeah, just a different species.
The one.
Maybe you can tell us a bit about your why. Why did you become a physician?
That's a good question. I think when I was in college, I was always fascinated with biology and the science end of things, not so much the chemistry end of things, but more the biologic end of things. And so I migrated toward zoology, was my major as an undergrad, and that's what attracted me, and then obviously veterinary medicine. So I would say I've always wanted to be in some biologic life science, probably since I was in high school.
That's amazing. And speaking more to your time here at PPMA and in previous practice, what are some of the most interesting conditions for you personally to treat?
Well, I think some of the more interesting ones are the ones that sometimes you stumble on. You might be looking for one thing, find another, and that always is fascinating, especially if it's something that helps the patient, and in many cases might even extend their life, if not their lifestyle. So I think that just stumbling into things sometimes are very rewarding. Others are what people have been doing for the last 50 years of their life. You change and it makes a big difference in life. So I think there's a number of conditions that fall in that category, but it's a matter of changing patients' lives.
Mm-hmm. And from what you've seen over the years of being a physician, what do you feel like is the biggest takeaway that you've learned about health from being a doctor?
Well, I think it's the impact I have on people. Plus, I think physicians also gain experience and knowledge from patients themselves. So you probably grow with the patients a little bit. So we gain some knowledge. It's not all give. We also get to take some of their experiences. So I think it's a matter of changing lives, both theirs and ours.
Wonderful. Thank you so much, Dr. 𝗵𝗲𝗄.
Discover the wellness you deserve. At Private Physicians Medical Associates, PPMA, you'll receive personalized premium preventive care and one-on-one medical attention with an emphasis on prevention, nutrition, and wellness. Extended office visits, appointment availability, 24/7 physician access, limited patient enrollment, PPO insurance and Medicare accepted. This is concierge medicine. This is medicine the way it should be. Call today for a free consultation at 949-566-8179.
And moving over to Dr. Weiss, thank you for your time today. Maybe you could just start off and tell us a little bit about yourself.
Well, I grew up on the East Coast. I was born in New York City, grew up in the suburbs of New York City, and then I went to Boston, both for undergraduate and medical school at Tufts, and did my internal medicine training in the Boston area. And then I wanted to do a pulmonary fellowship, and didn't like the programs in Boston. So at that point, I was married and had a little baby, and we were going to move. And if you move 50 miles away or 3,000 miles away, it's basically the same amount of work. And I looked around the country, and San Diego was the best combination of nice place to live and a good pulmonary program. Top 5 pulmonary program in the country. So that's where I went, and that's how I got out to the West Coast. So I graduated medical school in 1980, and I finished my pulmonary fellowship in 1986, which is when I joined the group up in Huntington Beach. Obviously, that's when I met Dr. 𝗵𝗲, and then, as we said, we left there in 2003.
Wonderful, quite the journey. And what would you say is your why behind being a physician?
I wanted to be a doctor for as long as I can remember. I mean, when I was a little kid, people would say to me, "What do you want to be?" And when you grow up, and it was always a doctor. I think that I may have been partially influenced because my grandfather was a doctor, but he died when I was, 6 months old or something. So I never met him. I never knew him. Obviously, I heard about him, but it was just something that I was always going to do. And, when I got to college and then medical school, and I started learning, for example, in college, if you're pre-med, you got to take chemistry, organic chemistry, etc. And I also took biochemistry, which is chemistry of what goes on in living organisms. And I just loved it. It was like the first class that I really loved. And then moving on to medical school and taking physiology and things like that, it just, I just loved it. So I suspect one of the questions that's coming, having listened to him, is, so what does it do? What is it about being a doctor that really does it for me? I think the number one thing for me is the encounter that goes on in the exam room. It doesn't happen anywhere else or with any other profession. You just don't get as intimate with people, including, and it's a very different type of intimacy that you'll even have with your spouse, because, with your spouse, you go down certain roads, but, with the doctor in the exam room, there are things you can ask that nobody else ever could ask. And you get to know people, and you get to know people in a way that nobody else does. That's one thing. But the other thing, to tag on to what Dr. 𝗵𝗲 said, is one of the real benefits, that this is surprising, but one of the real benefits about the concierge model is we have time. And so we end up chatting with people about things that are, if you have a 10-minute office visit, you don't have time to do that. But we have the time. So we end up chatting about things that are unrelated. And so often I pick up an important medical fact in that discussion that leads to a better diagnosis and a better outcome. So it's all about the interaction. For me, it's all about the interaction with the patient and helping them be healthier and live better lives.
Thank you so much.
So we know that you're a science geek, it sounds like. You love all your sciences. Maybe you can tell us about some of your favorite conditions to treat.
I'm totally a science geek. My undergraduate degree is in chemical engineering, so I had more chemistry probably than both of these guys together. But what can I say? And I'm still pretty geeky about it. learn one of my hobbies is cooking. And a long time ago when I started, I actually made bread. And I looked at the bread rising and I was thinking about the chemistry that was going on in there. So this is really geeky, but cooking is applied biochemistry. And I just love looking at what's going on and thinking about it. So that's why I like it. So you can't get more geeky. There's no one, as a pulmonologist, I always enjoyed treating lung conditions, taking care of patients, really sick patients who are in the ICU and all the things related to that. I like the numbers associated with that. Don't do that anymore, and I'm fine not doing that anymore. There's no particular condition that I like. It's really more about the interaction and finding what can we do to help the person, again, feel better, a little better life.
Yeah. And it sounds like you are very astute and a great listener. So are there particular things that over the years you have taken away just about health in general from your patients?
Yeah. I'm going to piggyback again on what Dr. 𝗵𝗲 said. Every single patient encounter is an educational opportunity for me. I mean, whether it's, I have a patient who walks, 10 miles a day. She tells me what her favorite walking shoes are. And then I go out and buy that brand. But it's definitely a two-way street. And that's what, again, I keep coming back to that, but that's what does it.
Life lesson. Thank you so much. And Dr. Davis, you are the newest doctor for the PPMA team, and we'd love to just learn a little bit more about you, and if you could tell us about your background.
All right, yes. I grew up not too far from here in Laguna Hills in Orange County, and after that, I went on to be a Bruin. I went to UCLA undergraduate, where I majored in neuroscience. Then ultimately went to UCLA again, Center School of Medicine, and with my medical degree there. After completing that, I went just a little bit across the city to Cedars-Sinai, where I had my internal medicine residency. I finished that in 2020, and then I did some work, kind of in various fields, some hospital medicine, some research, and then kind of during that time, I met Drs. Weiss and 𝗵𝗲, and as of recently, they have invited me to join their practice.
Wonderful.
It's a great decision on our part.
Smart guy.
Yeah. And what would you say is your why behind being a physician?
Yeah, it's it sounds like everyone kind of had different plans. Well, you always wanted to be a doctor. You were going to be a veterinarian. For me, I was going to look into being a PhD in neuroscience, and tried a little bit of time doing some what they call bench research, kind of sitting in a lab, and it wasn't for me. You do realize that even though you are affecting, you're having a role on people, it's very indirect. And medicine is so different than that. It is a science, it is a physiology, it is the understanding of the body, but it is directly applied to the person in front of you. And so I think after considering the PhD route for a little bit, and then getting some experience in hospital and volunteer work and so forth, I chose to go into medicine, and I continue to be able to have that direct impact on patients, and I love it. Even in the hospital, you see a different side of it. You see kind of the side of it getting out of control. But so many of our patients are ultimately, the issues they're dealing with in the hospital are consequences of what they call lifestyle conditions. Issues like hypertension, diabetes, and weight control, and all of those issues can manifest into those serious ways. And I think what I enjoy about treating it is that if you start early on, very simple and natural interventions can stop it before it even starts. And there are so many different avenues of approaching it. There's behavioral, there's nutritional, and there are medications as well. And by working with the patient, you can find which combination of those avenues is going to produce the best result for them.
And going off of that, based on what you've seen either in acute care or research, any of the other settings that you've worked in, what would you say are some of the biggest takeaways to help, whether that is related to the behavioral side or?
Yeah, it is all very tied together. Exactly. It's a bit of a cliche, but as they say, an ounce of prevention is worth a pound of cure. And I very strongly believe that that's part of why I am so excited to be transitioning from hospital medicine into PPMA's practice, is because I get to catch the patients that much sooner and I get to act there. And even if you can't always prevent it, still a pound of cure now is going to be better than 10 pounds of cure later. And so being able to work with patients in that way, I think it's easy when patients find themselves dealing with conditions or even more severe issues of those conditions to feel a bit of hopelessness. And a quote, again, to get a little bit cliche, but that I tell my patients is, the best time to plant a tree is 20 years ago. The second best time is now. It's never too late to make meaningful changes for your health.
Absolutely. And you alluded to it a bit, but maybe you can talk to us a bit about your why or what you're so excited about joining PPMA for.
Yes, it's all tying together. It's, again, being able to get in in the patients who are dealing with the earlier stages before they're in the hospitals, or even after they come out of the hospital, but trying to come up with a clear plan based on their values and wishes to get them to whatever state of health and well-being they want to be through the avenues that work best for them. I saw, when I first met Dr. Van Meter and Weiss and, looked into it, they have a little phrase underneath PPMA and it says medicine the way it should be. And I think that absolutely is true and accurate to describe what PPMA allows the doctors and the patients to experience. Because it's not just the patients who benefit from that. I think, a lot of physicians suffer emotional and mental harm from having to compromise the care they can give their patient and having to push them out the door because the next patient also needs to be seen. And being able to provide that kind of care, I think, does wonders for both parties.
Absolutely. And if any listeners are interested in learning more about becoming a patient at PPMA, where can they learn more?
They can definitely look things up on the internet. privatemds.com is our website, and we're here over in Newport Beach and are always open to an initial consultation.
The phone number is 949-566-8179.
Amazing. Thank you, three. Thanks so much for your time. We appreciate it.
Thank you.
Thank you very much.
Thank you.
Thank you for joining us for today's episode of Nourish MD, Dr. Dietitian Dialogues. This podcast is intended for general educational purposes only. It is not a substitute for professional medical advice. Please consult with your healthcare provider before beginning any nutrition or supplement recommendations. Sign up for our mailing list so you'll never miss an episode of our wellness journey. See the podcast description for the link.